It's October, which means it's Breast Cancer Awareness Month, and in South Africa, approximately 1 in every 31 women will develop breast cancer during their lifetime. I mean, the big C is a serious disease, so it's not surprising how misconceptions can grow into myths with a fair dose of fear. I mean, add emails and shared links on Facebook into the mix, and you may as well be reading the script for a horror movie, forcing you to never use deodorant or wear a bra again. But if you're facing a woe as serious as breast cancer, you need real information to help you make your decisions. What does the evidence say? How do the myths compare to the facts? Does wearing an underwire bra and using antiperspirant increase your risk of breast cancer? What do you think? Well, the good news for the rest of us is that there is no need to forgo using antiperspirants or any other kind of deodorant for that matter. There is no scientific evidence to support the claim that antiperspirant chemicals are absorbed through the skin, block the release of toxins when you sweat, and cause these toxins to build up in the breast. Even the strongest antiperspirant doesn't completely prevent sweaty armpits. And if it did, sweating isn't the most efficient way of getting rid of toxins anyway. There are also email claims floating around that suggest that chemicals such as phthalates and parabens used for fragrance may also be absorbed from the body and contribute to a higher breast cancer risk. To date, there have been no scientific studies to confirm any relationship. Whew. One less thing to worry about in the morning, spritz away. So what about underwire bras? Now, not that I'm a regular bra wearer myself and can't speak from personal experience, but I do know that most women complain about uncomfortable bras at some point. Throw in the thought of an underwire bra blocking the drainage of lymph fluid from the bottom of the breast, and it's enough to make even me feel uncomfortable. So what's the truth? Well, firstly, I would say it's important to make sure you have a comfortable bra. Don't worry about the color. And secondly, breathe easy. The consensus is that neither the type of the bra you wear nor the tightness of your underwear or other clothing has any connection to breast cancer risk. Women with larger breasts do not need to worry about being at a greater risk for breast cancer either. However, if you are wearing a larger bra size because of putting on weight, then that changes the situation some way. This difference in weight is where the risk lies, not in the type, size, shape, or color of your bra. There is also no evidence to support a link between breast cancer and a breast injury, like that flying hockey ball at school or toy cement truck at home. So now that we've debunked some of the more common myths, what are the facts when it comes to your risk? Many people think that breast cancer is all about inheriting bad genes, but the reality is that only 20 to 30% of women have a family history of the disease. A more important question to ask is, what can I do to reduce my risk for getting breast cancer? While there are some things that are simply out of our control, it's unfortunately quite hard to turn back your age, for example. There are other important risk factors that you luckily do have some control over. Firstly, as we said, being overweight increases your breast cancer risk significantly because fat tissue, unlike muscle, is hormonally active and produces small amounts of estrogen, which ups the cancer risk. Maintaining a healthy body weight throughout life is a good insurance policy against having cancer. Secondly, to stay active. On average, highly active women are 25% less likely to develop breast cancer than are women who get very little activity. So aim for at least 30 minutes every day. And finally, stop smoking and stay away from happy hour. Compared to women who don't drink any alcohol, there is a 10% higher risk of breast cancer associated with each drink per day. So while it's reasonable to worry about your risk, don't wait for the next email to tell you what that should be. Focus rather on taking steps to avoid the risk factors that we are sure about. Remember, the 3 key things you can do to reduce your chances of getting breast cancer are: firstly, get to and maintain a healthy weight. Secondly, stay active. And thirdly, stop smoking and limit alcohol. Big or small, treat your breasts as your greatest assets and look after them, for your male partners too.